When discussing improvements to U.S. healthcare policy, politicians from both parties often say that we have the best healthcare system in the world. That is a lie. The U.S. healthcare system is an existential threat to our country. If the American experiment fails, it will not be because we had the wrong marginal tax rate. It won't be because we don't have the perfectly optimized level of social safety net spending. It won't be because of the culture war and DEI issues and the media trumpets to orchestrate the division among all of us. No, if America fails, the chief reason will be because we let our country get sicker, more depressed, fatter, more infertile, at an increasing rate while crippling our national security, bankrupting our national budget with healthcare costs. Every major pillar of the U.S. healthcare system, as a statement of economic fact, makes money when Americans get sick. The most valuable asset in this country today is a sick child. The pharma industry, the hospital industry, and medical school industry make more money when there are more interventions to perform on Americans. And by requiring insurance companies to take no more than 15% of premiums, Obamacare actually incentivized insurance companies to raise premiums to get 15% of a larger pie. This is why premiums have increased 100% since the passage of Obamacare, making healthcare the largest driver of inflation while American life expectancy plummets. We spend 4 times per capita on healthcare than the Italians, but Italians live 7.5 years longer than us on average. And incidentally, Americans had one of the highest life expectancies in the world when I was growing up. Today, we've fallen an average of 6 years behind our European neighbors. Are we lazier and more suicidal than Italians? Or is there a problem with our system? Are there problems with our incentives? Are there problems with our food? During the COVID epidemic, we had the highest body count of any country in the world. We had 17% of the COVID deaths in this country. We only had 4.2% of the world's population. We literally had the worst record of any country in the world. All this should have been a blaring wake-up call to about our weakened American immune systems. Our health leaders said that COVID was a pharmaceutical deficiency. This was a lie. We have the highest chronic disease rate on earth, and according to the CDC, the average American who died from COVID had, on average, 3.8 chronic diseases. So these were people who had immune system collapse, who had mitochondrial dysfunction. And no other country has anything like this. 2/3 of American adults and children suffer from chronic health issues. 50 years ago, that number was 1%. When my uncle was president, about 1% of the children in this country had chronic disease. Today, that number may be as high as 60%. In America, 74% of Americans are now overweight or obese, including 50% of our children. 120 years ago, when somebody was obese, they were sent to the circus. There were case reports written about them. Obesity was virtually unknown. Today, almost 50% of teens in the United States are overweight or obese. In Japan, the childhood obesity rate is 3%. Half of Americans have prediabetes or type 2 diabetes. And when I was 10 years old and my uncle was president, a typical pediatrician would see 1 case of type 2 juvenile diabetes during his 40 or 50-year career. Today, 1 out of every 3 children who walk through his office door is diabetic or pre-diabetic. And it's causing, and diabetes, and the same mitochondrial disorder that causes diabetes is also causing the epidemic of Alzheimer's in this country, which is now classified as diabetes. And it's costing this country more than our military budget every year. It is a crisis that 77% of our kids are too disabled to serve in the United States military. In my generation, the odds and rate of autism were about 1 in 10,000. And in my kids' generation, 1 in every 34 children In the state of California where I live, it's 1 in 22. And by the way, there has been no change in diagnosis, which is the industry alibi. Study after study, there's been no change in screening either. Study after study shows that this is a change in incidence. We are in the midst of an epidemic. Why are we allowing this to happen to our children? These are the most precious assets that we have in this country. How can we let this happen to them? How can we call ourselves a moral nation, the exemplary democracy in the world, if we are treating our children like this? About 18% of American teens now have fatty liver disease. That disease, when I was a boy, only affected late-stage alcoholics who were elderly. Cancer rates are skyrocketing in the young and old. Young adult cancers are up 79%, and 1 in 4 American women is on antidepressant medication. 40% of teens have a mental health diagnosis. 15% of high schoolers are on Adderall. And 500,000 American children are on SSRIs. No other country has anything like this. So what's causing all of this suffering? I'll name 2 culprits. First and worst is ultra-processed foods. 70% of American children's diet is now ultra-processed, which means industrial manufactured in a factory. These foods consist primarily of processed sugar, ultra-processed grain, and seed oils. Laboratory scientists, many of them whom were formerly working for the cigarette industry, which purchased all of the big food companies in the 1970s and 80s, deployed their thousands of scientists to invent new chemicals to make our food more addictive. And these ingredients didn't exist 100 years ago. Humans are not biologically adapted to eat them. Hundreds of these chemicals are now banned in Europe, but they are ubiquitous in American processed foods. We are literally poisoning our children systematically for profit. The second culprit is toxic chemicals in our food, our medicine, and our environment. Pesticides, food additives, pharmaceutical drugs, and toxic waste permeate every cell in our bodies. This assault on our children's cells and hormones is unrelenting. They are swimming around in a toxic soup. And to name just one problem, many of these chemicals increase estrogen. Because young children are ingesting so many of these hormone disruptors, America's fertility rate has now dropped. Sperm counts in teens are about 50% of what they were a couple of generations ago, and testosterone rates have dropped at the same rate. American puberty rates among our little girls is now 10 to 13 years of age. Our country has the earliest puberty rate of any continent. This is 6 years younger than it was in 1900. This is not normal. Breast cancer is also estrogen-driven and now strikes 1 in 8 women. We are mass poisoning all of our children and all of our adults. Industry lobbyists have made sure that most of the food stamp lunch program, about 70% of foods, that most of the school lunch program, and about 70% of food stamps are processed foods. We give 8 times as much subsidies to tobacco in this country than we do to fruits and vegetables. It makes no sense if we want a healthy country. The good news is that we can change all this, and we can change it very, very, very quickly. And it starts with taking a sledgehammer to corruption, to the conflicts in our regulatory agency and in this building. These conflicts have transformed our regulatory agencies into predators against the American people, and particularly our children. 80% of NIH grants go to people who have conflicts of interest, and these scientists are allowed to collect royalties of $150,000 a year on the products that they develop at NIH and then farm out to the pharmaceutical industry. The FDA, the USDA, and the CDC are all controlled by giant for-profit corporations. Their function is no longer to improve and protect the health of Americans. Their function is to advance the mercantile and commercial interests of the pharmaceutical industry that has transformed them, and the food industry that has transformed them into sock puppets for the industry they're supposed to regulate. 75% of FDA funding does not come from taxpayers. It comes from pharma. And pharma executives and consultants and lobbyists cycle in and out of these agencies. Money from the healthcare industry has compromised our regulatory agencies and to this body as well. The reality is that many congressional healthcare staffers are worried about impressing their future bosses at pharmaceutical companies rather than doing the right thing for American children. Today, over 100 members of Congress support a bill to fund Ozempic with Medicare at $1,500 a month. Most of these members have taken money from the manufacturer of that product, a European company called Novo Nordisk. As everyone knows, once a drug is approved for Medicare, it goes to Medicaid. And there is a push to recommend Ozempic for Americans as young as 6 over a condition, obesity, that is completely preventable and barely even existed 100 years ago. Since 74% of Americans are obese, the cost of all of them, if they take their Ozempic prescriptions, will be $3 trillion a year. This is a drug that has made Novo Nordisk the biggest company in Europe. It's a Danish company, but the Danish government does not recommend it. It recommends a change in diet to treat obesity and exercise. Virtually Novo Nordisk's entire value is based upon its projections of what Ozempic is going to sell to Americans. For half the price of Ozempic, we could purchase regeneratively raised organic agriculture or organic food for every American, 3 meals a day, and gym membership for every obese American. Why are members of Congress doing the bidding of this Danish company instead of standing up for American farmers and children? Because Novo Nordisk is one of the largest funders of medical research, the media and politicians and the medical schools all go along with them. For 19 years, solving the childhood chronic disease crisis has been the central goal of my life. And for 19 years, I have prayed to God every morning to put me in a position to end this calamity. I believe we have the opportunity for transformational bipartisan change to transform American health, to hypercharge our human capital, to improve our budget, and I believe to save our spirits and our country. I am grateful for Senator Johnson's focus on this country's most important issue. Thank you.
Know anybody who doesn't demonstrate courage more than you have. I don't know of anybody. I don't know anybody who's been more vilified and ridiculed and marginalized and canceled or paid as heavy a personal price for advocating for children's health, for making the decisions you made over the last couple of years and literally in the last month or two. Not only is your concentration on chronic health something that is unbelievably important for this nation, and I think, as Tucker Carlson said about Dr. Casey Means, help change the world. What you have demonstrated in your new alliance, setting differences aside, concentrating on an area of agreement, I think represents exactly how we as Americans can unify and heal this nation.